Okay, so for this week's videos, we are doing our nasopharyngeal and nasotracheal suctioning. Today is October 14th, so I'm going to go ahead and start with that one. I'm going to talk about both a little bit in this video. I've got my patient here. I've got my suctioning kit, and I've got my suction that's connected to some intermittent low wall suction. So once I'm actually ready to start suctioning my patient, I'll turn the camera so that we can see that happening. But when it comes to our nasopharyngeal and nasotracheal, the biggest difference between the two is the lengths at which you're going to be suctioning. So for nasopharyngeal, we would just go from like nose to earlobe, and then for nasotracheal, you would go a little bit past the resistance of the once you hit the back of the throat, and you would go further down, closer down the neck area. So that's it with the nasopharyngeal and nasotracheal. For both, prior to suctioning my patient, I would go ahead and hyperoxygenate using either an ambu bag, or if my patient is on an oxygen mask, if they have a Venturi mask or a non-rebreather, I can go ahead and hyperoxygenate with that, just so that when we're suctioning, being that we're taking away their oxygen, they don't get hypoxic, and saturations completely drop. Another thing you would do when suctioning, your patient would be connected to continuous pulse ox, just so you can monitor their pulse ox as you're doing the suctioning, so that you will know when it is you need to stop, so that you can oxygenate the patient. Once you make sure you've got all those things done, you would obviously check your orders, making sure you have orders to suction. Regardless of how many times it says suction every 6 hours, we would only suction on a need-to basis. So if my patient doesn't need to be suctioned, I'm not going to put them through the hassle of suctioning them if they're not showing signs that they need to be suctioned. Usually signs would be they're obviously hypoxic, they can't breathe, they're having difficulty breathing, and they would obviously be in a lot of distress. You would be able to tell that they're having a hard time. So if the patient's showing any of those signs, you would go ahead and suction them based on your doctor's orders. So I've got orders to suction my patient, so I'm going to go ahead and start. My kit is sterile. This is a sterile kit. So I've got my suction connected already, and I'm just going to do nasopharyngeal for this particular video. So I'm going to go ahead and turn and back up a little bit so that we can see. So I've got my patient here. We're going to be suctioning nasopharyngeal. So I would sit my patient up in a semi-Fowler's position just to help better the breathing. Prior to me doing any suctioning, I would always do a lung assessment. That's super important. We would always assess the lung sounds before suctioning and after suctioning, just to see if there's a difference. And that can also guide you in knowing whether you need to suction a little bit more or not. So I've done my lung assessment, and my patient's got some wheezing going on, and I can tell that they're in distress and they need to be suctioned. So I've done my lung sounds. So I'm going to go ahead and wash my hands, perform my Kiwis, introduce myself to my patient, and let them know what it is that I'm doing. Hi, Mr. John Doe. I'm here to suction do a nasopharyngeal suctioning, just to help you breathe a little bit better and get rid of some of those secretions. And I would go ahead and educate my patient, letting them know exactly what it is I'm doing. If they have any questions, I would let them know what a secretion is. The secretions are, the mucus that's probably you're having a hard time getting out, things like that. If my patient's unresponsive, I would still go ahead and educate them and let them know what I'm doing, whether or not they're able to respond to me. Just etiquette of letting my patient know they're being, bothered. So let's go ahead and start. So I perform my Kiwis, wash my hands. I can go ahead and open my tray. I would always open away from me. I've got my normal saline here. I'm gonna check the expiration date. I see that it was open this morning, October 14th. So it's good for me to use for another 24 hours. Since this was not my first time opening, the bottle has been opened, I would go ahead and lip it just to clean the top. Before I do anything in my kit, before I get sterile, I'm gonna go ahead and open my box. The plastic is on the top, so I'm just gonna open the box, making sure the bottom touches, and I would not touch the inside of my box, okay? And once I've done that, I can go ahead and pour my liquid, my saline in. I'm gonna go ahead and lip the top. I've lipped it, so now I can go ahead and pour. Okay, now that I've got that, I can move this off to the side and I can go ahead and get ready to get sterile. I'm just gonna move this over to give myself some room. So I'm just going to get my sterile gloves. I'm just touching the 1-inch borders. I'm just gonna move that up out of the way a little bit. Just touching the 1-inch borders. I'm gonna put my right hand on first. Just going to do it as such. And these have been open, so they're a little battered and bruised. And then I'm gonna go in and under. Once I've done that, I'm now sterile. I'm just gonna move this out of the way a little bit. Sorry, my sister's singing. Okay, so now I'm gonna go ahead and grab my catheter. I know that my left hand is gonna be unsterile. My right hand's gonna be my dominant hand, so that's gonna stay sterile throughout the procedure, and the right hand is where my catheter is going to be held. So I'm gonna go ahead and grab my suction. We've got it on low intermittent. I would go ahead and connect my catheter to my suction. Again, I'm using my right hand. This is sterile. And this is going to be wrapped up into my hands. And I'm using my left hand to connect it and touch my suction. So I'm going to go ahead and connect. And this is my makeshift kit. So I would use here. This is my suction. I would use here to determine the suctioning, and I would never suction going in of my patient's nose. I would just suction out. Before I go ahead and start, I'm gonna go ahead and test my suction in my water, and it's suction good. So I would go ahead and lubricate this with my lubricant. Again, I'm gonna hyperoxygenate my patient. I'm checking the pulse ox. She's at 99 right now, but I'm still gonna go ahead and hyperoxygenate her with the ambu bag. Okay, now that I've hyperoxygenated her, I can go ahead and proceed. So she's sitting up in a semi-Fowler's position. I'm just gonna touch the camera to move it. Actually, I can just put my patient here so that we can see, or here, and I'll go this way. We're sitting in a semi-Fowler's position, and I'm just going to go ahead and suction. I'm going to insert into the nair. I'm going into the right nair, and I'm maintaining my sterile. I'm gonna go until I feel resistance, and I am not suctioning as I'm going in. So my hand is not on the port. Once it's in, and I'm gonna pull back, my patient's coughing. I'm watching those pulse ox. She just dropped down to about 95. So I'm gonna go ahead and start suctioning as I'm pulling out and twisting. I would have my patient take a deep breath as I'm doing this, and I'm suctioning. And I would note the secretions that I got out when I'm done. I'm gonna go ahead and hyperoxygenate her again because I think she needs a little bit more suctioning. So I'm gonna hyperoxygenate her again with her ambu bag, give her a little minute to recuperate. And then we're gonna go in again, same method, taking my finger off, go in till I get some resistance. She's coughing. So I'm gonna go ahead and pull back and have her take another deep breath. And I'm suctioning and twisting the catheter on my way out. Okay. And I would go ahead and wrap this up in my glove, and I could dispose of it in my glove that way. Again, I would go ahead and oxygenate my patient and make sure she's comfortable, make sure she's, and I would do another lung assessment to assess her lung sounds after the fact to see, if it helped at all. I performed another lung assessment. It sounds like my patient's got a lot of the secretions out, so she's able to breathe a little bit better. Lung sounds a lot better. So, job well done. And that's it for this video. Thank you.